A very good morning to everyone, whoever has joined us for our today's live session. So, today's topic is how to maintain a healthy heart. Myself, Dr. Lisa Basamatari, clinical pharmacologist. I welcome you all who has joined our today's live session, and I welcome with open-hearted Dr. Ankit Dedhia. I would like to give introduction for him. So Dr. Ankit Dedhia, a distinguished cardiologist serving the community at SL Raheja Hospital in Mumbai. So Dr. Dedhia brings a wealth of expertise to his practice, have achieved both DNB cardiology and medicine qualification. With a commitment to excellence in patient care and a dedication to advancing cardiovascular medicine, Dr. Dedhia stands as a trusted advocate for heart health in Mumbai and beyond. Patient can rely on his compassionate approach and comprehensive skill set for personalized cardiac care of the highest standard. I welcome you, sir. Thank you so much for your time for joining us for the live session. Sir?
Hi, Lisa. Good morning, and I'm glad to be a part of this. Tell me.
Yes, sir. Okay, so we'll start with our session. So my question will be the very first question I have this doubt that so what is healthy heart?
Wow. So you started with a sixer, and I like that. Today we are living in a T20 kind of situation, and sometimes a question like this: What is healthy heart? Now, or you can ask, Are you heart healthy? Also, it's the same. It's two sides of the same coin, and we are living in times where people think that heart problems are not for me, they are for someone else, but that's not the situation right now, and time is changing, and times are changing for every individual in today's era. So having a healthy heart means having a heart without diseases. And diseases means everyone thinks that heart disease means only heart attack, but that's not the case. We are seeing a gamut of ailments regarding the heart or related to heart, where patients think only having a blockage or a stent or a bypass is one problem of the heart. But that's not the case. Having a healthy heart is living a good, healthy lifestyle, or having the agenda is not to have a long but ailing life, but to having a good, heart healthy life where you can do routine things without any issues. So having a healthy heart means having a heart which is having the center of your body. It's the main powerhouse of your body. So having a healthy heart is to have no cardiac health disorders. That is what means by having a healthy heart.
So true, sir. But sir, like nowadays we hear a lot of young individuals that they are having heart problems. So what's the reason for that?
So yeah, so initially, if you see, the prevalence of heart disease has increased so much, incidence and prevalence for that matter. And maybe 10 or 15 years down the line, people used to think that having a heart disease is the age is going to be after 50 or after 60. But that has changed dramatically in the last 10, 15 years, and we see a lot of individual having much more much having issues much earlier of heart. So that is why it's so important to understand the that this is not a age related process. Yes, age does play an important role in having heart diseases, but it does not give a license that I will get heart disease only after 50, or I will not get heart disease in the age of 20s and 30s. We as cardiologists or as interventional cardiologists, I am facing almost one to two young population patients in a week who are having massive heart attacks and requiring stenting, requiring bypass also. Recently, we had a 24-year-old young chap, young boy, a college student, just finished his graduation, planning for postgrad, was having a heart disease. We had to put three stents, and so age has got no relevance in today's time. The age is younger or older individuals, both are equally affected. But yes, that has what you're saying is right. Your question is absolutely valid. Many people are thinking that why am I getting a heart problem at the age of 25 or at 30 or at 35, whereas my father is much healthier at 60, 55, 60. So that is related to the risks involved. What are you at risk for? So that assessment is very important. You need to know where you stand, and risk assessment, what risk factors are pushing you to have a cardiac disease, is important to know. And that's why it's so the younger population or younger individuals, males and females both, are predisposed to more and more heart disease in the recent times. That is the main. So risk factor assessment is of utmost or vital importance.
Yes, very true, sir. That's what, so we cannot rely on the ages. We cannot say that, if you're older or if you're above 50, then only you'll get heart disease. Anyone can get heart disease. As you mentioned, the risk factors, that plays a major role. So, sir, my next question will be about the risk factors only. So, sir, what are the risk factors which can cause these heart issues?
So, see, it's a very large or large spectrum question, risk factors, but let me divide it into two parts. Risk factors for heart diseases or having a heart issue are two types. One is non-modifiable risk factors, which you cannot modify or which you cannot, you can't do much about it. There is certain things which is modifiable risk factors, which definitely an individual can play a part and try to change where he stands with respect to that. So in the non-modifiable risk factors, where an individual, it's not in the individual's hands, is your genetic. One is genetic predisposition. So suppose if your parents or your grandparents are having a heart disease or a heart attack, and you are not taking a healthy lifestyle, then you are very highly predisposed to these conditions. And yes, cardiac diseases or heart risk factors are sometimes genetically predisposed, there where they transfer from age to age or with one generation to the other. So yes, hereditary predisposition is noted, is very well noted in our cardiology for generations getting heart problems. So yes, in India also, if you see the Asian countries, the Indian subcontinent, we do have a genetic predisposition where if your father had a heart problem, your mother had a heart problem, or if any one of them had a heart problem, you are, and if you don't keep, mind you, if you don't keep a check on yourself, you may land up with a heart problem. So genetic predisposition is one thing. Second non-modifiable risk factor is age. So sometimes, yes, it may be an age-related calcification, degeneration of your heart, arteries, valves, where you are going to age. If you are today, if you are 40, you are going to turn 45 in the next 5 years. You cannot turn 35. So yes, age will play its part. Will definitely play its part, where age is going to degenerate your valves or your arteries, or the calcification may increase. So age, genetic predisposition, these are two non-modifiable risk factors. Now, I'm talking about non-modifiable risk factors. Now will shift to modifiable risk factors. Now, modifiable risk factors are your your nuances, if I have to say. Nuances as in your alcohol is one modifiable risk factor which plays a big part in today's time, when every young individual or old individual thinks that having alcohol uninhibited, unplugged is being cool about. That is one thing which the mentality has changed in the last 10 years. A lot of younger people indulge into having large proportions of alcohol and land up in a hospital on the same night. So alcohol plays a big part. So that is a definite modifiable risk factor which can be modified by the individual himself. Second is smoking. It's the worst risk factor. I'll tell you what. It causes, you will not. It's like smoking in today's time, if I have to say, is like having a atom bomb on your own self. The effects will last 10 years down the line, 20 years down the line, 30 years down the line, you don't know. So smoking is another modifiable risk factor, which is so dangerous that patients don't understand. Individual will not realize on the day. The effect of smoking will give you a trouble much later in your lifestyle, in your lifespan, and that you will not understand right now. You will understand when the major disease comes to you. So smoking, yes, we see so many patients who are smokers who have smaller arteries. The arteries are shrunken, their hearts are dilated. So this is another major risk factor which we need to work on. We have to tell our patients and our individuals who are coming for checkups that smoking is going to injure you somewhere or the other. I'm not. I'm talking about only heart, where smoking can cause gamut of other problems like COPD, lung issues, cancer, oral cancers, buccal cancer, esophageal cancer. So, then smoking is number one killer, if you ask me. So, that is one another modifiable risk factor which we should work on. And uh, also in today's era, if you see post COVID has turned into a, it's more like AD and BC, how we have AD and BC. It's like before COVID, after COVID that we are living in. And specifically after COVID, the stress levels in our, which is modifiable, where you can work on reducing your stress. And yes, stress plays a big role in causing a major risk factor for heart diseases, where patients with anxiety have blood pressure, cholesterol, sugars. These are certain things which the stress can bring up on. So this is one more risk factor which is modifiable. The today's stress can be controlled. There are maneuvers to control your stress levels. So yes, smoking, alcohol, stress levels. These are your modifiable risk factors. And last but not the least, when you're talking about risk factors, you have to talk about the comorbid conditions which are going to damage you and your heart in a big way. Comorbid conditions would be uh, diabetes. India being the capital for is a diabetic capital. If you know, we are ranked two in the world with diabetic population. Blood pressure, which is every one third of individual by 2030 will be hypertensive. So comorbid conditions are very important: diabetes, blood pressure, cholesterol, and thyroid. These four conditions, along with obesity, five conditions are certainly, comorbid conditions which individual has to work out his way to, his work is cut out for, to, as a cardiologist, also as a healthcare professional, also, and as an individual who's being treated. These five comorbid conditions have to be treated on time, regularly. Regular follow-ups are very important. So modifiable risk factors like alcohol, smoking, stress, non-modifiable risk factors like age, genetic predisposition, comorbid conditions management like diabetes, blood pressure, dyslipidemia, obesity, thyroid disorders. These are certain things which form the risk factor. If I have to say, these things in conjunction work to have a patient having a heart problem. So heart disease will arise when one comes and the other adds on to it and the third adds on. So yes, and it's never one risk factor. It's multiple risk factors hitting you as an individual from different sides. Like a patient who's turning 50 this year. So age has come, who has a father having a heart problem in his younger age group. So yes, you are genetically predisposed. You are a social drinker, one or two cigarettes here and there. So you have had your modifiable risk factors, and you're diabetic, and you're hypertensive, or you are obese. So these three, four risk factors come together and hit you and hit your heart in that one point where your heart gives up. So heart disease is never a one issue affair. It's a multiple issues, multiple risk factors coming together, and you will not realize this until unless you do an evaluation for what your lifestyle is, or what how these risk factors affect your lifestyle. So that's why you need to assess your lifestyle. You have to regularly keep a lifestyle check for this.
Yes, sir. Totally agree with you, sir. So, sir, adding to this, can you just highlight the points, so what all lifestyle changes can, help a person to remain heart healthy?
Well, that is in today's time when preventive cardiology has taken the onus in our routine practices. Everyone thinks that cardiology is just doing putting stents or getting bypass done or doing angiography, angioplasty. That's not the case. Today, when we are doing cardiology workups or cardiology practice or as a full-time interventional cardiologist, many of my hours that I put in for cardiology is going into preventive heart care or preventive cardiology, where we want to prevent a coronary event or a heart attack for these patients. So that's why healthy heart is more of a is a eye opener to remain heart healthy and have a good lifestyle. So lifestyle modifications are very important. We as Indians, I would start my lifestyle modification with first and foremost is diet. We love eating. As Indians, we are always obsessed about what we eat. We are foodies. So I am yet to come across a most of our Indians, I'm saying. I'm yet to come across an Indian who's not a foodie or is not fond of his own food. So first thing is dietary modifications. Lifestyle modification has to start with dietary modifications. So dietary modification like your salt intake has to be restricted, or you have to keep a check. In the younger individual also we have so much of cheese, butter, all these junk food that we have. It's good for that time. It's good for the palate. You really enjoy for that 5, 10, 15, 20 minutes. But the after effect that it leaves on your body, if it happens on a regular basis, is going to be detrimental. So that's why lifestyle modification starts with always diet. What you're eating, how frequently are you having the junk food? Are you having homemade food or you're ordering too much of Swiggy, Zomato? That is, I see. That's why this dialogue or this discussion is going to be relevant to today's era. I'm adding up a lot of things which I'm seeing my patients doing, and I'm seeing a lot of Swiggy Zomato nowadays. Would you know the amount of Swiggy and Zomato used in 2024 is is as high as it gets in the last 4 years. So if you add 2020 to 2023, the last 4 years, together is equal or is lesser than what Swiggy Zomato was used in only 2024. And believe me, I've done my research on this. So that's why the food has become a number one killer for lifestyle. So food habits, junk food, how much your salt intake is, what kind of also non-veg food adds on to the cholesterol levels, and it brings on a lot of other things on table, red meat and all. So you have to be conscious in what you're consuming, where you're consuming, what kind of oils you're using. Everyone asks me, what doctor, which oil is safe? See, it's not about which oil. Every oil will have a pro and a con. Every oil will have a good factor and a bad factor. It's not about which oil is good. It's about how many times you're having the oily food. If I have oily food on a daily basis, it's going to hamper somewhere down the line. So that is where food plays a very big part. Next lifestyle modification, if I have to say, is your which every is like the underdog, which nobody cares about, is your sleep. Today's time where the career oriented people, or even for that matter the homemakers who are driven so much in their fast routine lifestyle, where sleep is the first one to get compromised. So lesser this, there are so many studies which have shown that the lesser the sleep, the more cardiac issues you're procuring too. So heart diseases like blood pressure, cholesterol are more prevalent in patients who sleep less than 7 standard hours. And 7 hours means 7 hours of good sleep. Many of us don't understand what is good sleep. There are two phases in sleep. I would not indulge into the details for sleep, but yes, 7 hours of sleep, maybe 6 in the night, 1 in the afternoon, or 7 hours at a stretch. Minimum 7 hours of good sound sleep is very important. In today's time where Netflix and Prime Video subscriptions have come to all time low, it's so difficult. It's so difficult. And COVID, remember, we have done all, I have done that. I have binged watched series in COVID, but yes, that time we were not working. I was working only stipulated 4 5 hours in the day. Remainder time I was home. That time, this habit of having Netflix or other platforms, OTT platforms on your mobile has made it so difficult for us to get sleep. Mind you, I'm not complaining to Netflix people, but I love Netflix. But it's the problem with this being at your digital platform being so easily available. So people don't know the importance of sleep. So sleep is the first thing which gets compromised. So sleep management is very important to get your lifestyle modified. So food, I'm revising food, sleep. Okay. Third is your addictions, which I already have mentioned, alcohol, smoking. But I do want to mention here in lifestyle modification, the third addiction, which is very commonly seen in today's time, is drug abuse. We see so many patients, which in definitely we are living in a metro, so we come across more often to such situations. Last month, I had a patient who was a cocaine abuser and had a 21-year-old boy had a heart attack. We had to put one stent for him. His parents were completely flummoxed as why my son got it. And cocaine is a big risk factor for, cocaine and other drugs, I would say, are big risk factors for blood pressure management and heart diseases, or for blood pressure and heart problems. And because it is so rampantly available everywhere, you have to make sure that you don't indulge into all these things. So yes, drug abuse is I would say is at its all-time peak, and it definitely leaves a mark on heart. So drug drug abuse along with addictions like smoking, alcohol is my third risk factor, where sleep, diet, addictions. Okay. And comorbid conditions like diabetes, blood pressure, cholesterol, thyroid, obesity. So these five comorbid conditions have to be regularly kept under check. That's where we come in as a cardiologist or as a physician. You have to visit your doctor every 2 3 months or whenever he calls you with your blood test, with your to check your regular parameters. So controlling these comorbid conditions is important. You cannot leave it for chances. So these disease can be modified or can be controlled. I may not say that I can make diabetes vanish away. No, I can't do that. But I make sure that my HbA1c is below 7, and preferably if it's below 6.5, I'll be very happy. My patients will have a lesser risk of having heart problem. Similarly, if my blood pressure cutoffs are well managed, my LDL targets are well managed, my weight control is well managed, my thyroid TSH is well managed. So these patients are going to have lesser cardiac issues if they are well managed comorbid conditions. And before I stop my lifestyle modification, last but not the least, stress management. We always underrate stress. So, visiting a psychologist or a psychiatrist or having a counseling session is not a problem nowadays. We can have it more frequently. We can discuss with our psychiatric friends or counseling friends. But yes, it's important because work stress, today's time where deadlines are so relevant, you really need to work on that. So stress management, whether so every individual who has a 1 BHK wants a 2 BHK, who has a two-wheeler wants a four-wheeler, who has a four-wheeler wants a better four-wheeler. So these are the situations where we are into, and we really need to, into inverted commas, know what you want, whether you want a stressful lifestyle resulting into cardiac problems, or whether you want a lesser stressed life with a good healthy heart. So these are few things which, as in lifestyle modification, we should highlight onto what we have to do.
So I must say that I totally agree with you, and I think it was very rightly you said that all these factors are in our control, but we are not focusing on that. So even the diet or the sleep and even the stress management, whatever we are consuming, we already know that this is harmful, but still we are not taking care of it. It's our under control, but we are not looking. That is very important, which you have highlighted. So, sir, I mean, I have one more question, sir, for you. That how can one keep a check whether heart is healthy or not?
So that is the icing on the cake. So that's where we come in as a cardiologist. I would plead, or I would request everyone to check whether you are heart healthy or whether you're healthy at heart. So these are certain things which you never know what. So you cannot predict when you're going to get a heart attack, or you cannot predict when you're going to become diabetic, or when you're going to get hypertension. But if you don't check, you will never know. So that's why preventive cardiology provocates to get the patient evaluate himself to see whether he's got these issues or not. And that's why a routine cardiac health checkup is so important. So initially it was like, yeah, I will become 50, I will do my heart checkup. No. Now the time has changed, as I mentioned earlier also, that every individual should get a routine health checkup or a cardiac health checkup once a year, visiting a cardiologist. If I have to put a deadline, yeah, once you start in your later 20s or maybe 25, I would give a basic cutoff of 25 and above, which was earlier 40 and above. Now has shifted to 25 and above. So 25-year-olds, we believe me, I cannot share my data, but I have got so many 20-year-olds coming to me for routine every 2-3 months for blood pressure and diabetes, who are having blood pressure, diabetes, and are on medicines reluctantly, but they are on medicines. So these are certain things where I would want to put in at 25 and above, do a cardiac health checkup. If your cardiologist or your physician feels that you're stable enough, we may not do it every year, but without checkups, you are not going to land up in safe zone. Nobody is safe or nobody is in safe water till you do a checkup. Once you do a checkup or cardiac evaluation, only then you will know that whether you are having any risk factors, any comorbid condition, or whether your lifestyle is unhealthy. This will be brought out to you by your cardiologist or a physician. So that's where we come in, and we really want to have a healthier population where we have lesser heart problems, lesser heart disease, or lesser heart attacks in near future. So I urge everyone to have a routine cardiac health checkup, maybe once a year, or if you're stable enough, if your first checkup is good enough, maybe once in 3 years also can be done. But if you are diagnosed of diabetes or blood pressure or cholesterol, or you are obese, or you're having addiction, or you want to de-addict yourself, you come to us. We will help you with this, and we may get you back on track. That's the way we see it, that getting you back on track, preventing your cardiac diseases in an unhealthy lifestyle. We want you back on a healthier lifestyle. So that is what we are here for.
Yes, sir. An individual should always, visit a doctor. So whether it be any condition, but then regular checkup is really it keeps you updated on your life or your health checkup. So yes, sir. Thank you. Yes, sir. Yes, sir.
Also, Lisa, one more. It just struck me that many people ask me, what test should I do? So, see, you don't need to do an angiography at the age of 25 for every routine checkup. Angiography is not needed for every individual for a heart checkup. Everyone has this myth, okay, if you go to a cardiologist, he's still going to put stents on you. No, that's not the case.
Yeah.
So we are evaluating you at a basic level where you do a basic ECG, 2D echo, you do your lipids, your HbA1cs, your thyroids. These are the basic evaluation where you are having a comorbid conditions or not, whether you're having risk factors or not. And you just do a basic ECG, 2D echo to begin with. Suppose if your ECG is showing some changes or your 2D echo is showing some changes, whether your heart is dilated, you have LVH, or whether one of your chambers of the heart is not functioning well, then your cardiologist will tell you, okay, no, you seem to have this problem, or you seem to have blood pressure, or you seem to have, thyroid or diabetes, let's evaluate you one shade more, or maybe you need a stress test depending on your symptoms, whether you're having chest pain, when you're having dyspnea, or whether you're having breathlessness on climbing stairs. So then your cardiologist will add, if required, again into inverted commas. People think that once we land up in a cardiac health checkup, we are going to be evaluated directly to the angiography. No, that's not the case. If you need, and if only if you need, you will be asked to do an angio. But otherwise, routine cardiac checkups don't include angiography. A lot of people have this in mind, take CT angio kara lete hain. That's not the case. If you are not, if you are not at risk, nobody is going to ask you to do a CT angio. Thank you.
Right, sir. Right, sir. Thank you so much, sir. Yes, sir. Like, I would like to, now we have to conclude the session, and I would like to thank everyone who has joined us today, and a special thank you to Dr. Ankit Dedhia. Thank you so much, sir, for your giving time and your valuable insights and priceless tips to tackle such a simple but a complex issue of heart disease nowadays what we are facing. And lastly, thank you for opening my eyes, because I'm going to check whether my heart is healthy or not. And I'm sure that everyone has learned so much today from you, and even they are thankful for that, on behalf of them also and behalf of me also. I'm very much thankful to you. Thank you so much, sir.
Thank you. So at the end, Lisa, I would just tell everyone that being heart healthy or having a healthy heart is the same thing, but you have to strive hard to make sure that you have a healthy heart, to have a good lifestyle. So have a healthy heart. Thank you.
Healthy heart. Thank you,
Or
sir.
should I do this? What do you
Yes,
do now?
this
Sorry.
is Korean heart.
So have a healthy Korean heart.
Thank you, sir.
Thank you.